Traditionally, seeing a patient was a straightforward process.
In the early 1990s, we just devote all the time to care for the patient instead of administrative tasks.
It was so-called the golden age. It was very simple. We simply see the patient, we treat the patient, we give a prescription, we scribble a few lines on the chart, and we're done.
However, in the mid-90s, a dramatic shift in healthcare accompanied the introduction of the HMO delivery system to the East Coast.
At that time, all the practice physicians were very anxious, very worried. They do not understand the government policies, and they do not understand HMO structures.
If you look around, more than half of the country's solo practitioners have given up their practice. They cannot handle the policy and requirement given by the insurance company and Medicare this day.
Under the pressure of their circumstances at the time, a group of Chinese physicians united under one vision: to help their physicians and their community overcome the rapidly changing healthcare environment. And thus in 1998, CAIPA was officially founded.
CAIPA exists because we want to support these individual doctors.
What we wanted to do is try to understand how we can help the physicians in the community.
It is critical that we have the trust and confidence between the physician community and the health plan. And CAIPA serves as the bridge between the two.
We're filling the dark space between the providers and all the wants and needs of the health plan and the patients. We try to get the best reimbursement for the doctors so their office can function efficiently.
The financial security is very important. CAIPA signed a lot of contracts with a good reimbursement. This is very important for us.
Over the years, healthcare policies and regulations have fluctuated with each administration. So much so that independent clinics find it difficult to keep up with these changes.
The biggest challenge today in healthcare is the complexity and the financial changes that we all face.
Right now, we need to do a lot of quality reporting mandated by insurance and also government.
We have all kind of documentation requirement you need to meet. There's all kind of administrative work you need to do. So you have basically, as a physician, less and less time.
What everyone really wants to focus on is investing in taking care of patients. And so we all in the healthcare world are trying to maintain that focus while dealing with the regulation and the changes in the financial system.
CAIPA has strived to aid their physicians in staying updated with policy changes and provide assistance in understanding new regulations.
When they announced all those policy, CAIPA actually sought out all the necessary change, alert the provider to be ready, to be prepared for the changes.
They go out and they educate their providers on what they need to do, what measures they need to meet, and that is so critical to us being successful and for CAIPA and their physicians being successful.
Training for front desk staff members has also become necessary as the entire clinic teams up to compile follow-up paperwork for every single patient.
The first year I work for doctoring, we just help patient register and then make an appointment for them. Not like we have to do a lot of paperwork.
Every time when they're done seeing the doctor, we have to go over every diagnosis to know what medications for, the doctor order any exams, if the exam's been done, if the medication's been approved, has it been to the pharmacy. So if Dr. Chan's working by himself, it'll be hectic for him.
To ease the burden, CAIPA provides training to their members to help streamline workflow and make the most out of quality incentive programs.
The quality of taking care of the patient is the most important thing for us. And so we always wanted to train the physician to get into certain programs, such as PCMH.
What we do is we will actually bring the staff and doctors into a classroom setting and provide the training of what is patient-centered medical home. We will also go to the doctor's office, work with them one by one.
They really help us organize the whole office to achieve the highest level.
As you would expect with any large system, you're going to have high performers and low performers. And I think that CAIPA is really on the right side of the bell curve, high performers.
In order to help physicians give as much time to their patients as possible, all forms of assistance are available from CAIPA.
When Medicare require reporting of 6 to 7 CPT code per patient claim, And CAIPA was able to help the CAIPA members report that. So that saved a lot of time.
So they provided technical assistance and provided human resource support.
Well, this particular doctor, he was out of network. He had a lot of unpaid claims, but they didn't know that, and they were still seeing patients. We got the doctor back in network with this particular insurance company, but we just took care of that for him and got everything paid.
We never beheld the promise. They always respond to us very quick, even in the middle of the night. I really appreciate what they did for us.
In the end, whether it's the IPA, physicians, government, or HMOs, the fundamental wish is to bring the best care to the community. For Chinese physicians, despite the current medical climate, the age-old value for medical care, deeply rooted in Chinese tradition, still lives today.
It's a well-known fact within New York State that the Asian community and the Asian providers have done an exceptional job. There has been a culture of commitment to medicine, there's been a culture of commitment to patients, and a culture of commitment to high quality and efficient care that's unique.
The patient is a human being. We have to help patients to have this better quality of life.
When they step into the office, I know who's their father, who's their mother, and who introduced whom to come here. And that is a remarkable experience. So this kind of a trust, and it is really a privilege.
I am really fortunate to have a great team of doctors out there taking care of the people in our community. I am so proud to be associated with these doctors.